Good morning. It's October 10th and this is your daily brief in science. Here's everything you need to know. A recent study from Oregon Health and Science University has confirmed a vital component of brain health, the glymphatic system. This system is crucial for waste clearance in the human brain, and researchers have successfully imaged the cerebrospinal fluid pathways in 5 human brains, revealing how this waste disposal system operates. The study uncovers a newly discovered network of fluid-filled structures that help clear toxic proteins associated with Alzheimer's disease. Cerebrospinal fluid flows through these channels, flushing out harmful proteins like amyloid and tau, which are linked to dementia. These findings suggest that perivascular spaces play a significant role in managing brain waste, akin to the lymphatic system in the rest of the body. MRI images indicate that cerebrospinal fluid channels are active conduits, facilitating the distribution of fluid throughout the brain, rather than being passive spaces. Dr. Juan Piantino, a senior researcher on the project, highlighted that the cerebrospinal fluid moves through defined pathways around blood vessels. Neurosurgeon Aaron Yamamoto noted that the MR1 images illustrated a clear transition in these spaces as the contrast tracer permeated deeper into the brain. This breakthrough may pave the way for new strategies in treating or preventing Alzheimer's disease. Future research could focus on enhancing this waste disposal system, with quality sleep potentially improving its effectiveness. The findings were published in the Proceedings of the National Academy of Sciences, confirming the existence of these crucial fluid channels in humans, a discovery previously limited to mouse studies. The FDA has granted marketing authorization for a new testing solution that could change how we approach respiratory illnesses this fall. The Helgen Rapid Check COVID-19 Flu A and B antigen test is specifically designed for individuals showing respiratory symptoms, allowing for quick and efficient testing. This innovative test detects proteins from SARS-CoV-2 and influenza A and B viruses using a simple nasal swab, providing results in approximately 15 minutes. It is intended for self-administration by individuals aged 14 and older, while children as young as 2 can be tested when assisted by an adult. In anticipation of increased demand during the upcoming respiratory season, Helgen plans to ramp up production of these tests, as stated by company president Brian Fang. The tests are expected to be available to the public and healthcare providers by Thanksgiving 2023, with prices ranging from $13 to $16 each. Consumers will have access to purchase these tests through major retailers like Amazon and CVS. The FDA's approval is anticipated to facilitate the development of similar at-home tests by other companies, enhancing consumer access to testing options. Dr. Michelle Tarver from the FDA highlighted the importance of effective detection of respiratory pathogens as flu season approaches, advocating for more at-home testing options. Helgen's CEO, Bingliang Fang, noted that early diagnosis through this test can lead to timely treatment and reduce disease transmission. Dr. Arshel Georgiou emphasized that the test could help lessen emergency room visits, thereby alleviating pressure on the healthcare system. The FDA recommends that individuals experiencing respiratory symptoms utilize the test, but also seek healthcare advice regardless of their results. It is important to note that while the test is a valuable tool, there is a risk of false negatives. Individuals with negative results but ongoing symptoms should consult a healthcare provider. NASA has released a white paper emphasizing the urgent need for improved cargo delivery capabilities for future lunar missions. This comes in light of the agency's plans to ramp up operations on the Moon, particularly through the Artemis missions. In September, NASA issued a request for proposals aimed at tackling lunar mobility deficiencies and enhancing logistics for upcoming missions. The agency is looking for innovative solutions from U.S. industry to develop new designs for landers and vehicles that can support these ambitious lunar endeavors. This initiative is part of NASA's Next Space Technologies for Exploration Partnerships, known as Next Step 2, which focuses on fostering the commercial development of deep space exploration capabilities. Currently, NASA can deliver approximately 1,500 kilograms of cargo, but future missions may require the ability to move between 4,400 to 13,000 pounds, highlighting the need for larger delivery capacities. Existing lunar mobility solutions, including the Lunar Terrain Vehicle and pressurized rover, have limitations in their cargo capacities, which further emphasizes the need for advanced solutions. The proposed cargo lander must ensure the safe delivery of cargo while providing essential services such as power, communications, and thermal management for effective offloading. Key logistics items for lunar missions include food, water, air, and spare parts, especially critical for operations at the planned lunar South Pole. As NASA intends to increase the frequency and duration of lunar missions, the demand for effective logistics will grow significantly, necessitating enhanced capabilities. Efficient transportation of landed cargo from landing sites to operational areas is crucial for successful lunar exploration. Nujood Moranci from NASA has noted the importance of collaborating with a diverse range of commercial partners to enhance the exploration architecture. Brooke Thornton from NASA's Strategy and Architecture Office has also expressed the agency's interest in creative insights from industry to inform their logistics and mobility strategies. Plastic pollution is escalating into a critical global challenge, with an estimated 22 million tons of plastic waste leaking into the environment in 2019. This figure is projected to double by 2060, highlighting the urgency of addressing this issue. Each year, around 20 million metric tons of plastic waste enters the world's waterways, further exacerbating environmental degradation. In response to this pressing problem, innovative solutions are emerging from various organizations, including academic researchers and startups. Researchers at Rice University have developed a nature-inspired adhesive that utilizes bioengineered microorganisms specifically to tackle marine plastic pollution. This technology enhances the adhesion of bacteria to polyethylene terephthalate, or PET, which is a major component of plastic waste that is notoriously difficult to break down. By incorporating polyethylene terephthalate hydrolases into the adhesive, researchers enable the breakdown of PET into smaller molecules through a process known as biorecycling. Tests have shown a remarkable 400-fold improvement in the bacteria's ability to cling to plastic at 37 degrees Celsius, resulting in significant degradation of plastics overnight. In another innovative approach, EVA Biosystems, a startup from the University of Edinburgh, has created a smart plastic that self-destructs in water without producing harmful microplastics. Dr. Alexander Speakman, the founder of EVA, emphasizes that their technology enhances existing plastics, allowing them to decompose inappropriately discarded locations. EVA's innovation earned recognition by winning the top prize in the Net Zero category at the Converge Awards, along with a cash prize of £30,000 and additional business development support. Additionally, an adhesive inspired by the stickiness of mussels has been developed to prevent biofouling on various surfaces. This mussel-inspired adhesive utilizes a naturally occurring amino acid called 3,4-dihydroxyphenylalanine, or DOPA, and could protect underwater structures, such as pipes and ship hulls, from the accumulation of algae and barnacles, enhancing their longevity and effectiveness. Scientists at the University of Pittsburgh have made strides in Alzheimer's research with a new blood test platform that can measure over 100 biomarkers related to the disease. This innovative approach aims to enhance early diagnostics by capturing the complex pathology of Alzheimer's through clinically validated biomarkers. In a proof-of-concept study, researchers analyzed blood samples from 113 cognitively normal older adults using the new-alzheimers-discovery-emerges disease 120 panel. This panel not only measures classical Alzheimer's biomarkers like phosphorylated tau and amyloid beta, but also includes around 120 additional proteins associated with neurodegenerative diseases. The performance of the new-alzheimers platform was validated against traditional assays, showing promising results in detecting biomarkers correlated with amyloid positivity and changes in amyloid burden over time. Additionally, Karikari's team is developing a predictive model to correlate blood biomarker changes with cognitive assessments and brain autopsy data. Tracking changes in blood biomarkers over time is critical for early intervention and treatment planning. Early detection of changes linked to neuroinflammation and nerve cell communication is essential for improving treatment effectiveness. Senior author Thomas Caracari highlights the need for a multifaceted approach to understand Alzheimer's and its progression, emphasizing the importance of using multiple biomarkers. The ultimate goal of this research is to identify blood biomarkers that can stage Alzheimer's disease and predict its progression, aiding clinical decision-making. Current diagnostic methods for Alzheimer's are often criticized for being resource-intensive, time-consuming, and burdensome for patients. This study received support from the National Institute on Aging and involved contributions from various researchers at the University of Pittsburgh. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.